Hi, my name is Sherry, and I'm the primary caregiver for my mother. She is a 77-year-old woman who is currently struggling with a variety of health issues. Her primary health issue is a little understood chronic autoimmune disorder. The disorder leaves her with deficient B and T cells and a variety of other immunoglobulin that she needs to maintain a healthy immune system. The first signs and symptoms of her illness occurred probably in her early 40s, and they included upper respiratory infections, chronic sinus infections, fatigue and anemia, and a host of other gastrointestinal issues. Her primary physician was treating her for a long time until it became apparent that there was something else going wrong. So we sought out the help of different specialists in the areas of COPD and autoimmune disorders. I guess when she was probably in her mid-50s, we ended up at a teaching hospital, and they ran testing, but unfortunately on each of our returns the doctor was either unavailable or the test results ultimately were lost. So it was so discouraging that in quite a bit of traveling and time invested that we decided not to go back. Instead, we decided to work with a very empathetic physician that she had that seemed to be at least providing some relief. Her symptoms progressed, and ultimately she was diagnosed with COPD, which we knew was not the primary issue, but and all of her other symptoms became worse, and in spite of having a very strong attitude, a courageous attitude, she became very depressed, anxiety-ridden, and just basically was starting to give in to the disease. We had multiple specialists that started coming in. We had cardiac people, pulmonary people, neurologists getting involved because of cognitive issues that were creeping in. She was had early onset of dementia from the illness, many gastrointestinal issues. She had quite a variety of specialists, maybe even a dozen at the highest point. It was her allergist that sent us up north at one point on a hunch to an immunologist out of the area, who ultimately diagnosed her with hypogammaglobulinemia, which is the name of the disorder that she has. And although it was a simple blood test, what happens is it often goes overlooked because people's symptoms mimic those of many other illnesses. And although it was only one blood test, we later found that 7 years previous they had diagnosed her up at the teaching hospital, but we never did receive the results. And the unfortunate part of that is that the best prognosis for patients with this disorder is that there's early diagnosis and treatment, because scar tissue and mutations and things like that occur that affect the eventual outcome and mortality of the patient. There was an immediate coordination between physicians up there and down here, and they immediately put her on there's a couple of treatments, but the most effective is immunoglobulin infusion. It's referred to as IVIG, and she goes once a month for approximately 6 hours and has the infusions. The medication itself costs $50,000. Her insurance does pay for it, and does Medicare. That's just the medication. They're probably a matching $50,000 for hospital use and specialists involved in the treatment. Unfortunately, the side effects from the treatment are dramatic. She has developed high blood pressure. Her cognition has worsened yet. She ended up having, with no previous heart issues at all, she had earlier heart caths. She ended up having to have heart surgeries, gastrointestinal surgeries, sinus surgeries, and the side effects from the the infusion that helps minimize the amount of infection she has, have caused problems, additional problems that require medications to treat the side effects, which have her at the point now where she's actually coping with medication toxicity. The story goes on and on. She's now 77, so within 10 years her condition has worsened as we expect it to, but and we've had multiple challenges: lack of communication between doctors, specialists only looking at their situations, mistakes with medication, administration of medications on a regular basis and treatments that she needs, respiratory treatments, disagreements between physicians, hospitals dropping medications off of her lists and causing near fatalities. About 4 to 6 months ago, my mother was hospitalized for 3 weeks and had lost 50 pounds and was failing pretty rapidly. Her anxiety and her depression had become severe. She had to have 4 blood transfusions, and basically many people were telling me in the medical industry that she was fine. She was fine, but when I consulted privately, I was told, her body systems are breaking down. And at 77, if she was in good health, it would be hard for her to tolerate going in and out of AFib, having heart surgeries, having chronic pneumonia. But in this case, her gastrointestinal, her systems were breaking down. She had asked to simply go home and go off all the medications, and she was starting to forget everything, including her children and situations that happened 5 minutes before, and she felt as if her quality of life was so poor that she wanted to go home and go off the medications and enjoy her family and enjoy, what life she had left in a medication-free way. I consulted with a physician of mine who had helped me through 2 previous situations, and we talked about hospice. And he asked me to consult with a physician friend of his who was a palliative care doctor. And he also did hospice if the time came that we needed that. We met with this doctor and everything changed. We had one doctor that worked tirelessly to look at her entire medical history, to oversee her care from all of the care that was given by the multiple physicians, any hospitalization she had, her medications. He looked for problematic situations and worked at resolving them. He added in multiple testing that could resolve some of the issues that she had and treated them. And he advocates for, from what we can tell, for the most part, entirely for the well-being and peace of mind of the patient and the quality of life. He supports the family and the patient, and he also supports the physicians and helps cultivate a sense of camaraderie and working together through the challenge of giving this patient the best quality of life. We've had multiple support staff coming to the house helping. It's been one of the biggest challenges to make sure that medications are administered properly and care is given in a timely fashion. Too much outside care has been problematic for her because it creates anxiety. But overall, we have less problems with pharmaceutical mistakes. We have less problems with medication being administered. We have less problems with disputes between physicians and ourselves. And in the hospital, we have an advocate, so to speak, and life has become entirely different. Most significantly, that there's new hope now for us, that there is potentially better quality of life down the road for my mother. We're working hard at preventing hospital stays, eliminating unnecessary illnesses, and keeping her home as much as possible. and reducing the amount of medication she's on so that she can become more lucid and involved in her own life. And the supports, there's no words to say how thankful we are for that, to help coordinate that care.